My name is Anetta Raysin, and I am the Program Director of the Psychiatry Residency Training Program here at Maimonides. There is truly no other place like Maimonides. I started here myself as a medical student, and then I chose to come here for residency. I chose to stay on as an attending. I am incredibly lucky to have the first-hand experience in being trained here.
We have a long history of training psychiatry residents. We're in our 41st year of training residents. I think what makes the program unique and special is that we are a tertiary care hospital. We are an academic department, but we serve communities. The tremendous amount of diversity that is Brooklyn, New York, is also reflected in the patients that we see. And so residents really get a healthy education in treating all types of psychopathology and all kinds of ethnic groups, and also being supervised by faculty attendings that also share a tremendous amount of diversity. The Department of Psychiatry is comprised of two clinical divisions, an acute care division and ambulatory division.
The real strengths of our acute care services is that we have a dedicated standalone psychiatric emergency room. It allows for manage our own patients in the emergency room, but also to interact very closely with the emergency medicine personnel. NE6 is a 30-bed inpatient unit, and NE4 is a 40-bed inpatient unit. So we have up to 70 patients at any given time, and we have 7 attendings. So there's about a 10-to-1 ratio of attendings to patients. Each attending works directly with the residents.
Those ambulatory services are the foundation of long-term care for our vulnerable patients. Our patients, just like anybody with diabetes or asthma, are patients who have ebbs and flows of their illness, and we are with them throughout that process. We take care of kids, adults, the geriatric population. We take care of anybody who walks through the doors.
I think a huge strength of our program is that there actually is a wide range of clinical experience. So we have some attendings who have been here for actually decades, which means that they really know a lot about the history of the department and the history of the hospital, and they have a lot of knowledge and wisdom that they can bring to bear. And then we have some people who are as new as me, who are like just a year out of training and bring a certain energy and inquisitiveness. So you're gonna get a lot of really good supervision from a wide range of attendings.
There were a few things that really drew me specifically to Maimonides. It's in one of the most diverse areas that you'll come across anywhere in the United States and perhaps in the world, because it's at this sort of intersection of a bunch of different neighborhoods that have historically been predominantly Latino communities, predominantly Asian communities. There's a large Orthodox and Hasidic Jewish community in the area. So knowing that I was going to be able to serve a very diverse set of patients was something that was really important to me.
One of the big strengths of our program is that if you do express an interest to administration, to attendings, they make a program for you, pretty much. They really helped me explore the parts of the field that I was most interested in.
So here at MIMO, I do feel like I'm getting a very well-rounded education. Not only are we exposed to various different clinical cases, we are given the opportunity to really immerse ourselves in research. So I definitely feel like I'm well supported in all of those things, and it prepares me well to take on anything.
So I was looking for camaraderie. I was looking for a place where residents were happy. I was looking for a place that incorporated wellness into the residents and making sure they're well taken care of. They're trying to stress how important it is to de-stress. So I knew that was the kind of place I wanted to be at.
I know we have a lot of different attendings here at Maimonides and different specializations coming from a wide range of backgrounds.
So we have some attendings trained in geriatric psychiatry, and we have attendings trained in addiction. We have attendings trained in consult liaison psychiatry. We have a pretty robust child and adolescent psychiatry department. We do have forensic psychiatrists as well. We have attendings that are fresh out of residency, so they kind of understand where you're coming from. And we have attendings who have over 40 years of experience, which is always great to have.
Our residents tremendously benefit from having the opportunity to complete their rotations on the main campus at Maimonides, which helps them develop a very close-knit relationship and bond, which adds to the camaraderie and overall family feel that the program has to offer.
What makes it really unique and special is that family value. I know that because I'm a former graduate of this program here, a former chief resident. Actually, I was born in this medical center many years ago. Some folks joke that my parents forgot to come pick me up, and they've been floating around ever since.
The attendings and residents are very close. They work very close to each other. From like the medicine department and the ER department and the psychiatry department, all these departments work really close to each other. Yeah, it really does feel like a big family over here.